Time now for Restoring the Soul of Healthcare from the HealthCare Clinic in Austin.
Yes, it is that time for us to visit with our friends from the HealthCare Clinic, and once again joined by Dr. David Strobel and Lee AC. Gentlemen, good morning.
Good morning, John.
And
with you.
Today is really kind of a big day. You see, we're going to visit a little bit about a new health sharing program, kind of an alternative to insurance. So dive on in. I'm curious what this is.
Yeah, we've been holding these workshops over the last 3 weeks or so with open enrollment to help people decide, how they can best configure their health insurance if they have access to health insurance to be able to cover for some of the big expenses that healthcare clinic membership doesn't cost, for things like specialty care and hospitalization. Well, for full family health insurance, it can cost about $2,000 a month if you're needing to go out and purchase that. We've done a few blog posts about some other health sharing programs, which is a sort of a less formal way of it's formal, but it's not insurance. It's just an alternative to insurance. But the one that we've affiliated with and developed a relationship with, we see a lot of advantages with it. So it's called Zion HealthShare, and we've got a blog post about it up on the blog on the website yesterday. But for example, for a family membership for someone 50 to 64, you're looking at $515 to $790 a month instead of $2,000 a month, depending on the plan. And then for people who are members of a direct primary care clinic like HealthCare Clinic, that in that same category, people could save anywhere from $90 to $150 a month on their Zion, membership dues, because they recognize that if you're getting good quality, regular primary care, it's less likely that you're going to have a major expense. And so they recognize that and they give a reduction. So by combining, a healthcare clinic membership and Zion, it could give a really pretty broad range of coverage. It covers the day-to-day expenses, the most of the care you need through healthcare clinic, but then you have something to protect you on the high end as well if something catastrophic happens. And the rates are 50 to 65% lower altogether, the total package compared to that, high deductible health plan that I was talking about at $2,000 a month. And then the other part of it is that whereas with a high deductible plan, then you still have a lot of out-of-pocket expenses because you're going to be paying for all your lab tests and for per visit fees. With your healthcare clinic membership, you don't have those either. So it's the savings sort of start at 50 to 65%, and then they probably go up from there. So we're excited to have this as a sharing option. One of the things we appreciated about it as well, many of the others have a requirement for a Christian profession of faith. This is one that doesn't. It requires people to, subscribe to ethical standards and all, but it's, we want to make something like this as available as broadly as possible, no matter what people's personal convictions are.
And kind of like what you always say is that, you talk about the savings kind of at a base level. It really depends on the individual, how they use the plan, what their situation is going to be. But at a minimum, they're going to be saving a pretty significant amount of money over the term or over the following year as they use those services.
Yeah, that's correct. And that, a lot of people will say, well, is this insurance? And you think, well, the generic concept of insurance is that you've got something in place that can help you if you have catastrophic costs. Mm-hmm. So then we can't say that these sharing plans are insurance, but they serve the same purpose. They basically are kind of a safety net for if the costs are catastrophic. And so then this is just a different way of saying, how do you finance this particular product? And so we've come up with the clinic system that keeps the costs low for day-to-day stuff, and then there are these kinds of options for the more catastrophic costs. So it's really it's a robust product, it appears to be.
Really, will people look into it? Because I'm sure, as we've talked about this and in the back of my head, I probably have a million questions we don't need to get into now, but people certainly do your investigation, get a hold of the healthcare clinic and ask the questions that you have and get that clear picture because, well, knowledge is power and make the right choice for your family.
Yeah, it's absolutely. And our colleagues at Zion who have said they welcome opportunities to just talk through for different people whether this is a good choice for them. But we're glad to be able to, our whole goal is we want to, for the things that we cover, we want to cover that, but for the things that we can't include, the things that we can't do here at Healthcare Clinic, we want to help people get the best prices and the best, most savings and the best service they can, through other means. And so helping to sort of scout that out as part of our mission here too.
I'm always impressed at the way that you've worked through the months that we've been doing this and finding ways to deliver these products to folks and expanding what you can do as you're able. It's pretty impressive.